Joining us at this point is Kiran Mazumdar-Shaw, Executive Chairperson of Biocon India Limited. Thank you very much indeed for speaking with us at this point. What, in your opinion, were the biggest takeaways from the Finance Minister's press conference yesterday?
Well, the way I look at it, Ankita, is that yes, the Finance Minister has come out with a stimulus package for MSMEs and, in which a number of measures have been announced. But I personally believe that these measures have fallen way short of stimulating demand. You cannot just stimulate supply because where are you going to supply if there is no demand? So I think MSMEs need a demand creation for economic revival. And I wish that the measures had gone towards, say, for instance, reducing GST, to nudge demand creation or people spending on buying things because you do it for a very definite period of time. For instance, the UK, it has actually done away with VAT for a certain period of time just to stimulate demand. So where is the demand stimulus package is what I want to see. Because otherwise, it's all very well to tell, the MSME sector that we're going to pay back your dues, which of course they were entitled to, that they are going to get guaranteed, loans by the government. And also that, they are going to be able to reduce the TDS so that people get more money in their hands. But these are very small incremental kind of measures that is not going to stimulate demand in any way. And therefore, I worry that, the economists who are shaping this kind of policy are not looking at it holistically. I think we need to use this adversity to actually come up with bold economic reforms, bold legal and legislative reforms, bold regulatory reforms. We have been thrown into the deep end in terms of a digital economy. Let's use digital platforms to remove half the regulatory hurdles that don't make us efficient. So these are the kind of things I think the revival package also needs to look at.
In terms of the overall figures we've been hearing, yesterday's announcements amounted to about 5.5 lakh crore. So presumably we are going to hear more measures being announced today and perhaps over the course of the next few days. So, apart from this holistic picture that you talk about, what about specific sectors that you would like to see addressed?
Look, Ankita, I think there are many, many seriously affected sectors and we all know which they are, okay? I think we know that travel, tourism, hospitality, these are sectors that are badly affected. We know that real estate is also badly affected. So if you want to, bring back spending into these kind of sectors, first and foremost, the unlocking phase has to be handled very well because we don't want, again, to get into a lockdown phase because we don't know how to manage the spread or the surge. But I think what we also need to make sure is that these sectors, you start creating some demand. And how do you create that demand? That's really the issue. So I think sector-specific measures also have to be announced. But obviously, no government is willing to really, completely underwrite the kind of losses or the fiscal challenges that these kind of sectors have. So you need to think of other out-of-box measures to revive these kind of areas. The other thing is, I think, as far as I'm concerned, I'm looking forward to many more of these announcements. So I don't want to comment before I hear the next dispatch of the stimulus package.
Fair enough. But what about healthcare infrastructure in particular, ma'am? Because, we've now heard that 2,000 crores from PM CARES is going to be spent on more ventilators. But is that going to be enough? For instance, we've been reporting on this very worrying situation in Mumbai's hospitals where rules have been tweaked to now allow less space between beds and COVID wards. These wards are also running out of ventilators. So are we actually staring at a potential Italy-like situation in Mumbai, for instance, which now has 21% of India's overall cases?
Well, there is certainly a very, very alarming situation that we are looking at in Mumbai, and we are also looking at sort of growing concerns around maybe, Ahmedabad and even Delhi. But I think what we really need to look at is how do we use this adversity and learn these lessons from COVID-19 to see how we strengthen our public health system, our primary care system, and our government medical ecosystem. I think if you look at it, the government hospitals are doing a phenomenal job with very limited resources, with very frugal resources. It's time we started investing in creating a much better and upgraded healthcare system in our country. The government has to spend more. We cannot deny and deprive the common man of decent basic healthcare needs. And that's why the government hospitals and the entire public ecosystem of healthcare has to be invested in. As you know, we are spending less than 1%, and we've been asking the government for over a decade to really, double this expenditure at least in healthcare. This is the time to do it. So I would also like to see a stimulus package that goes to strengthening our healthcare system. And I think this is an opportunity for us to do that and really make sure that health, education, and the basic needs that people have is addressed. Because one good thing that has happened is that Ayushman Bharat has actually covered the lower strata of society. And I understand they've just crossed a very big milestone of 1 crore of people. And I think this needs to now be extended to many other people. I think the middle classes need to be covered under a universal healthcare system. This will also augur well for the Indian pharma sector and for the hospital sector. And there needs to be a much closer working relationship in a model that encompasses both the public and the private sector. We know that a large number of beds are also available in the private sector. But today the private sector is not able to basically participate in this because they also need their regular business. And so they have created small COVID hospitals so that it doesn't sort of, impinge on their basic healthcare services.
Yes. We've also heard the WHO's emergencies chief, Michael Ryan, say, and this comes even as coronavirus cases around the world now cross the 43 lakh figure. He said it was important to put on the table that the virus may just become another endemic virus in our communities, that it may in fact never go away. Is that a view you subscribe to?
Well, we are living with so many viruses. Viruses don't just disappear, okay? Let's look at even the SARS, the H1N1, and many other such viruses. They hang around in the environment. I think the important thing for us to really understand is how do we manage this disease, this pandemic. I really believe that once you find an effective treatment, which saves lives, I think it'll give us confidence, because until the vaccine arrives, you will need a treatment that gives people the confidence that this is not a fatal disease. That's where we need to get to. And I think there are a number of ongoing trials, and let's hope that we find a treatment that works, because that's what removed the fear from AIDS. And I think this is what we need to do for COVID-19 as well.
Ms. Shaw, we heard Union Minister Nitin Gadkari saying in an interview to NDTV, we have to understand the art of living with corona. And then he went on to say this is not a natural virus, this is an artificial virus. And now he talked about how it was created in a lab. And therefore that makes the search for vaccines that much tougher in a sense. Your thoughts on that?
Well, I think there's enough scientific justification that this may not be what Mr. Gadkari is talking about. Yes, there are lots of, aspersions made on the Wuhan virology lab saying that this is something that has escaped from the lab. But obviously there is no proof. And there are enough scientific, sort of discussions that basically point to a virus that has mutated and basically caused this problem. So, it's not about whether it is a mutated vaccine or a created vaccine. The point is, if we know what the virus is about and if it has spread the way it has, we can develop a vaccine against it. So it's not just because it's if it is alleged that it is a created virus, it still has to follow an RNA backbone. And if you know the sequence of that backbone and you know how it is basically, causing the disease and infecting people, you should be able to develop a virus. A vaccine.
Ms. Shaw, of course, that is the multi-million-dollar question, and one that, all our viewers keep wanting to know about. In the search for a vaccine, what kind of time frame are we possibly looking at, with so many countries around the world now on the job? For a while we were talking about a 3 to 6 month period. Is it still that? Has it now been extended with more research on it? What are we looking at?
Well, as you know, there are 8 clinical programs in the clinic, okay? And I think that gives you some comfort to know that the probability of success is quite high, because you've got so many, there are 100 programs under development the world over, but 8 of these have moved into the clinic, and therefore you believe that one of these obviously will definitely, hopefully work. I, for one, remain very hopeful because of the kinds of vaccine approaches that these companies have taken. And I, for one, believe that, the Oxford vaccine group, the vaccine group in China, the vaccine group in Germany, and the vaccine groups in other parts of the world, including the US, are very confident and quite optimistic about them getting into phase 2 and even early phase 3 trials before the year end. I think what we have to understand is, once we start seeing the immune response to the vaccine, and if we can start seeing the immune endurance, the immunization endurance, we could get an emergency use, conditional approval before the year end, because that's what will allow us to then vaccinate a lot of the vulnerable part of our population. But until then, I think we do need to make sure that we develop systems and methodologies to stay safe. I can share with you that in Bangalore, there is a group of us who are working out a very interesting technology-based solution to assess the risk levels of different parts of the city and the state. And this can be actually, rolled out across the country. I think the Arogya Setu app is a very interesting app, because it actually tells you within a certain radius how many people have downloaded the app, how many of them are, feeling safe or have been called safe, how many people are not feeling well, how many people are positive. This kind of information is very, very interesting. And using such data, you can actually start assessing the risk levels of each ward, each zone. And you can start adding the risk level, like if, depending on the age of the population, the disease burden of the population, of NCDs like diabetes or cancer or hypertension, you can start building risk assessment models for people. And you can start creating kind of safe green zones and channels where people can very freely go. And depending on that, you can also start opening up, whether you want restaurants to be opened in this area, whether you want anything else to be opened. These are very interesting models to give us more and more confidence that, look, we are safe.
Ms. Shaw, could you in fact give us a few more details about this new tech that you're describing, that the Bengaluru group is looking at, and how it could actually work in the days ahead?
Well, it's very, I can't give you too much more information. I think in a week's time, we'll be able to share this information with you, but it's being done collectively by, people from Microsoft, Intel, and many others who are really just giving up their time to come out with this very, very unique, app, or not app, but a model that can help any state government to map out the risk factors of each part of their state. And this is something we can even share with the world, because I think this would be very exciting for people to know which are the areas that are safe to open up and to what extent.
That sounds absolutely fascinating, and possibly the biggest tool governments and indeed states could have in the way forward as we learn the art of living with COVID-19. Kiran Mazumdar-Shaw, as always, it's wonderful speaking with you. Thank you very much indeed for joining us.